Hello everybody and welcome back to Torn. In this video we break down the meniscus, another very important structure within the knee alongside the ACL. My goal of this video is to provide what the meniscus is, where it's located, its job and what it does, but also the importance of what happens when a meniscus tears and how we can affect the long-term recovery following. So let's dive into it. So the first question that we want to answer is, what is the meniscus? Well, the meniscus is a piece of cartilage, more specifically a piece of fiber cartilage, that sits between the femur and the tibia. So between our thigh bone and our shin bone, we have what's called a meniscus. In each of our knees, we have two meniscus. The medial meniscus is on the inside of the knee and is slightly larger and more C-shaped. It covers a bigger portion of the tibia, or a shin bone, and is more firmly attached to the joint capsule, which makes it less mobile and more prone to injury. The lateral meniscus is on the outside of the knee, slightly smaller, more circular, and more mobile. Because it can move more, it is less likely to tear than the medial meniscus. So the second thing that we look at is, what is the job of the meniscus? So multifactorial, the first job that we see for the meniscus is that it absorbs shock. So when we walk, run, jump, land, anything plyometric or sport related, the goal of the meniscus is to absorb shock. So as we load that joint between the femur and the tibia, the meniscus acts as a shock absorber. The second thing that it does is it disperses pressure. So the way I always talk about this is, if you're sitting at a football game on an aluminum bench or wherever, and you're sitting there without something underneath you, your butt's gonna hurt after another 30 minutes to up to an hour. Think about if you sat on a pillow or one of those cushions that you see, people sitting on. What that does is it disperses pressure, so you don't have as much pressure right on one spot. Another job of the meniscus is to stabilize the joint. So the stabilization aspect of it, the meniscus actually look like wedges. So a little bit more cushion on the outside, a little bit thinner on the inside. That allows the knee to sit nice and correctly inside the meniscus, which allows stabilization to the joint. So thirdly, we want to talk about how the meniscus is injured. We usually describe this in two different ways. One would be an acute injury. Acute or traumatic tears usually happen from sports, like planting your foot and twisting your knee, pivoting quickly, or landing awkwardly from a jump. The opposite of that would be more of a chronic or degenerative tear. The degenerative or chronic meniscus tears usually develop slowly over time as the cartilage wears down. So even small movements like standing up or squatting can tear it. This is what we would categorize as a chronic meniscus tear as opposed to something traumatic like in sports. There are also different types of tears. More complex tears, such as the radial tear or root tear, generally require some sort of non-weight bearing progression right away. So usually up to 6 weeks is how long it takes for that meniscus to actually heal, and then you can start putting load down and weight down through the crutches to begin with. So therefore, as you see, the type, location, and the complexity of the meniscus tear can all affect what the surgeon goes in and does, and certainly can affect the rehab following surgery. So over the past 10-15 years, what we've seen in the research is that the meniscus is vitally important. So back in the day, even 10 years ago, you'd see some athletes who had meniscus tears and their surgeons would just operate on that meniscus and take it out. That's what's called a meniscectomy. Nowadays, we're starting to see research that the more you take out of the meniscus, the more quickly you start to develop osteoarthritis. And that not only plays a role in long-term health, but also immediate pain, swelling, stiffness, and in turn causes the knee to go through more surgical interventions, potentially a total knee reconstruction down the road. So we want to save the meniscus as much as possible. And that's what surgeons are starting to do nowadays, is you see a meniscus tear and immediately their response is, how can we repair this, not take it out? So when a surgeon goes in and visualizes the meniscus tear and sees whether or not it can be repairable, ideally we try and repair it. If it's irreparable, meaning that it can't be repaired, that portion of the meniscus is taken out, and that's what's called a meniscectomy. If it can be repaired, we try and do what we can. But once again, that requires nuance, and it requires specifics to the type of meniscus tear, the location of the tear, and the complexity of the tear. And that all determines what the rehab is going to be like afterwards, including weight-bearing status and range of motion. Timeline-wise, we're looking at anywhere between 4 and 6 months, depending on what that person wants to go back to. So for an athlete, for example, generally we say around 6 months is an appropriate timeline, given everything looks right, their strength, their return to whatever sport they're required to do. But if you're getting back to something stationary or a little bit more, simple, that might be a little bit earlier in the process, maybe even 3 to 4 months before you start to see function go back to normal. The phases of recovery following a meniscus injury and certainly following a meniscus repair are simple to start. We want to get swelling out of there, we want to increase range of motion, and we want to get back some sort of quad strength. From there, we start to look at how does that person's function look like. So are they able to get back to walking without crutches? Can they take stairs? Can they sit down and squat onto a chair? Those simple kind of activities of daily living. From there, if it's an athlete and they're getting back to some sort of movement, the next phase is let's get them back to running. And then from there, we can get them back to jumping, landing, cutting, and eventually return to sport. So as you can see, the meniscus is a drastic and very important structure of the knee. So alongside the ACL, it provides protection and coverage for the stability and health of the knee joint. So we want to take care of the meniscus long term because it does increase the likelihood of osteoarthritis and some of these issues that you see down the road, into your 40s, 50s, 60s. Thanks for watching. If you're a physical therapist or other medical professional looking to elevate your ACL rehab practice, visit tornuniversity.com and book a one-on-one consultation where you can speak with me directly about any specific challenges you may face and fine-tune your approach to ACLs. Don't forget to like, subscribe, hit that notification button for more content, interviews, and more. Follow me on social media at Torn University for more daily ACL related topics. And as always, drop any comments or questions you may have about ACLs, and I'll catch you guys in the next video.